Hi everyone, my name is Dee, aka Woody. I'm a physical therapist working in Montreal, Canada, one of the co-founders of the IPC, Integrated Pelvic Care. I created the IPC framework for treating men with pelvic pain, intending to help clinicians optimize their clinical skills and generate consistent results. When I started treating men with pelvic pain, the history taking was the part I was struggling with the most. Frequently, I found myself running out of my time, and my questions were all over the place. I did not have enough time to do a good physical examination. At the end of the session, I had no idea what was going wrong with my patient. So often, my patient left without the proper education and treatment. We all know history taking and physical examination are the most important part of our initial assessment, especially the history taking. Good history taking will lead a more efficient physical examination, and together they will help us to get the right diagnosis. The patient sitting in front of us, holding all the information we need to treat the patient, but how to get them. Taking a good history for men with pelvic pain can be very challenging because the presentations always be complicated and different personal experiences, psychosocial factors, and sexuality. There are just so many things we can ask. So then I start to reflect on it and think about what are the questions I need to ask in my initial assessment. Depending on what you are looking for, the questions we ask in the initial assessment vary from person to person. For example, if it's the same patient, uh, let's say about 15 years ago when I practiced medicine, the question I ask will be completely different than the question asked today as a physical therapist. So at the moment, my initial goal will try to rule out any infection, inflammation, systematic disease, trauma, or cancer. But today, as a physical therapist, my goal is to find out where is this pain from. Is this pain from the pelvis or is from outside the pelvis? Is the pelvic floor the primary problem or just secondary issues? So keep that goal in mind that I came up with these 10 key questions. And these 10 key questions will help me to organize my history taking, and I will ask them every time I have a patient with pelvic pain. So when I start to use this method, and I found my practice change dramatically. My initial assessment become way more enjoyable, and I start to ask less and less questions, but I find the information will come to me eventually. I start to listen more and more my patient, and which make me to understand my patient even better. And I no longer struggling with my time. I always had enough time to do a good physical examination and give the proper patient education and give the right exercise for patient to do. Today I'm going to share these 10 key questions with you because I believe if they help me, it will help you, and then we can help more patients. I will make another a series of videos to explain to you the significance of all these questions and why we have to ask them. And every 2 weeks, I will share a case to demonstrate how to apply these 10 key questions into our practice and how these questions will lead me to do a more focused physical examination and to get the right diagnosis and to prescribe the right exercise for the patient. So remember, together we can help more men and make their life better. I'm looking forward to see you in the future case discussion. And thanks for watching and have a good day.